See, people are coming back now from the rural health session too. So as you guys come back, you can see people from the Family Voices session sharing things that they learned. So please let us know what you learned in the rural health session that would be useful to share. There's a link in chat to share those. If you have questions that you didn't get answered, you can also share those in the chat and we'll see if we can get them answered for you if your session ended. We're seeing things up there about, I was in the Family Voices session, so I'll share a little bit about what I'm seeing up here, and then we'll hear from Andrea about what she's seeing up here that people appreciated. I think everybody saw that Family Voices has a lot of tools to support things that people working in genetics need to do. So one of the things they have a lot of resources on is family engagement. We've talked a lot in this meeting about why it is that we kind of invite all voices to the table and that we want families here to share their perspective. So for other organizations that are trying to expand their family engagement, Family Voices has a lot of tools you can use to see how you're doing right now and to expand that. And I think a lot of people in our session also got to check out their state-based family to family, and saw that there were a lot of things there that families that need genetic services or are using genetic services, or the providers that are taking care of them, could really utilize and rely on as we try to link families to the things that they need outside of the genetics office. Andrea, I don't know if you're seeing anything up here that
Yes. So we talked a lot about resources in our concurrent session, resources from HRSA, from NRHA. Many of those were shared in the slides and will be in the document, the workbook. And so yes, so some comments I saw here. HRSA has regional offices that you can connect with regarding their programs. I saw a comment that's now gone off the screen, I think, about NRHA's resources, that it's refreshing to hear about all of these initiatives to improve access to care. So I think we learned a lot about, the initiatives that are happening that can help to maybe continue some of the work that NIMAC has been doing in rural areas.
we definitely heard in previous years in the conference that rural health is a big issue for a lot of our families and a lot of our providers that are, looking for better ways to take care of families that don't happen to live near the medical centers where the genetics providers are. So really happy to have been joined this year by people that are doing that work and organizations that have resources to support people that need to do that work. So we appreciate that. If you haven't yet, if you're just coming back and haven't had a chance to share in the Mentimeter that's up on the screen, there's a link to the Mentimeter where you can share your takeaways. And yes, if you chose one session, but you're curious about what happened in the other session, they were both recorded and those will be up and shared with you within the next few weeks. So you can check out anything that you didn't get to see. I'm just reading something someone put in the chat. So
Yes, so that might have been me.
yeah. But the role of AI.
Yeah, I think that links to the last comment here on the Mentimeter too about technology. So for the speakers that joined us back in the main room, I didn't know if anyone had any comments on that question about the role of AI. And if not, we can try to get that question answered afterwards. It looks like maybe some of our speakers haven't joined back into the main room yet.
Well, I think that people have a lot of hope and fear about AI simultaneously, right? Like that there's definitely things that we are hopeful that it can solve problems that we're facing, like, people are mentioning. But then I think everyone's always a little like, make sure we know what we're doing, right?
Yes,
Unleash
I
it.
feel
There's
like
a lot of people smarter than me about that issue.
right. I feel like I learned something new about a new use of AI every day almost. I think one thing that's important to keep in mind that I learned recently was that at least for the public AIs, things like ChatGPT, right? Everything you put in there goes into a public kind of database. And so we need to be careful, of course, if we're talking about health information, what's going in there. But simultaneously, a lot of organizations are working on developing some of their own kind of AI learning modules so that information stays within the organization.
Oh, that's really interesting. Okay, good to know. All right. Well, we really appreciate you guys coming back and kind of sharing your take homes with people that weren't there again. If you want to check out the other session and you didn't get to, it will be released as a recording soon. And the slides from all the sessions are already available on the website. So if you're super curious about what happened over there, you can already go check out the slides.